and closer to the blood pressure reading goal that has been agreed upon between the doctor and the patient. The patient should also see decreased symptoms with hypertension and a decrease in need for frequent telehealth visits or in person. Let's continue on to part 2. Assess the contribution of your intervention to the patient or family satisfaction and quality of life. Based on feedback received from the patient and family on this intervention, to incorporate more technology-based healthcare as a solution to the problem, the patient and family seemed satisfied with this plan. The interventions proposed enhance the patient's experience by giving the patient more autonomy over his care at home. Medical health applications with alarms and reminders can increase medication compliance, while applications that share ambulatory blood pressure data with patients' physicians can foster improved patient-physician dialogue, as well as patient-directed feedback. Thangda et al. 2018. Describe your use of evidence and peer-reviewed literature to plan and implement your capstone project. The principles of evidence-based practice informed research aspects of my project. The evidence-based practice principle of finding and using the best available research and evidence that had been peer-reviewed and clinical experts with patient values directed the research. I used only articles, journals, and studies that have been peer-reviewed by clinical experts since 2018, within the past 5 years. Recent, relevant, and credible pieces of research have been analyzed and applied to this capstone project to foster the best outcome for the patient problem of hypertension management. Using this research, I was able to plan and implement my capstone project. Assess the degree to which you successfully leveraged healthcare technology in your capstone project to improve outcomes or communication with the patient, family, or group. I feel that I successfully incorporated healthcare technology as a strong part of my interventions for this capstone project. With the interventions in place for telehealth communication with the patient and the healthcare provider, this will improve compliance with healthcare visits and ultimately the patient outcome. Also incorporating the apps for hypertension management for internal and external factors will improve the patient outcome and improve the patient's hypertension management at home. There are opportunities to improve healthcare technology use in future practice. I feel that technology should be used in healthcare more often and earlier on in treatment of the patient to foster autonomy and independence for the patient. However, it is case-by-case basis, and not everyone is tech savvy enough to utilize the technology for the telehealthcare visits and healthcare apps. This would need further assessment to see if the patient can and does have access to the resources to utilize this service. Also, it could be evaluated that someone else might be able to assist the patient accessing these services and assisting in the technology management side, so the patient could still receive the services just with a little bit more assistance at home. Explain how health policy influenced the planning and implementation of your capstone project, as well as any contributions your project made to policy development. The Ryan-Haidt Act was a federal policy created during the COVID-19 pandemic to allow patients to still be able to meet with their doctors virtually from home while safe and away from the risks of exposure to deadly viruses for compromised patients. Portman, White House urged DEA and HHS to extend Americans April 1st, 2022. This is a major federal policy that has changed the way that doctors are able to provide health care to patients. It has shaped a new era of telehealth care for the patient. This was a major influence on planning and implementation of my capstone project. I believe that incorporation of telehealth visits will show compliance with the healthcare plan and improved patient outcomes. It is possible that this could be a new approach to managing not only hypertension, but other disease processes that require more accountability and attention in not only the hospital, but in the home. Note specific observations related to the bachelor prepared nurse's role in the policy implementation and development. The American Heart Association discusses a major issue of reducing costs related to the $33 billion that the U.S. is spending on cardiovascular disease each year and recommends that telehealth is an important strategy in order to do this. Schwam et al. 2018. We are in a pivotal time for healthcare and need to look at new innovative ideas to solve this problem. There's a call for the government and policymakers to incorporate telehealth into policy and implementation. Based on my observation in the field of nursing practice since the Ryan-Haidt Act was initiated, telehealth is underutilized, and research shows that it increases patient compliance with the treatment plan. It should be strongly considered and encouraged when planning care for the patient. Explain whether capstone project outcomes matched your initial predictions. Discuss the aspects of the project that met, exceeded, or fell short of your expectations. The aspect of my project that met my expectation is that people are resilient. The patient was very different in the way that he acted in the beginning of our nurse-to-patient relationship versus the end of the interaction with the patient. The patient was able to come back from a serious state of illness from the beginning to the end, being more managed and confident in the disease process. He ended up exceeding my expectations towards the end by how enthused he was related to the plan and the interventions we had implemented together in order to manage his hypertension. The aspect that fell short of my expectations was how much the family did not want to be involved in the management of the patient's care. They have experienced the caregiver overload and wanted to be as hands-off as possible in the care area for direct care. However, they were supportive in the independence and were still supporting the patient when it came to communication, pushing him to be more motivated, providing more supportive care rather than direct hands-on care. Discuss whether your intervention can or will be adopted as best practice. I feel that the interventions provided have been adopted as a best practice based on individualized and specific care for patients that are able to utilize technology. I do feel that this is just the tip of the iceberg and that we will see technology in the healthcare management more prominent in the future. Describe the generalizability of your intervention outside this particular setting. I believe that these interventions are very versatile and could be applied to many settings. The basis of the interventions is to provide autonomy for the patient to manage the disease process at home and maintain open communication with the healthcare provider via technology. Incorporation, utilizing more telehealth option, and medical health monitoring apps for technology. I believe all settings of healthcare want to adopt these interventions that will work for their patient. Assess your personal and professional growth throughout your capstone project and the RN to BSN program. The provision of ethical care for patients with disease management issues would be implementation of more technology-based management interventions. Ethical care of the patient is being able to be sensitive to the needs of that patient. Providing the best option for the patient to receive the care that they deserve is an ethical provision that I would encourage when looking at patient care. The professional standards of care have not changed, but the delivery of them has. It is time for healthcare to catch up with the technology of our current millennium in order to progress the standards to match the time. Identify specific growth areas of which you are most proud or in which you have taken particular satisfaction. I'm particularly satisfied with my ability to think outside the box and adapt to what my patients' needs are. I have been able to grow my creativity in nursing by taking my ideas for how to improve patient outcomes and applying them to tangible interventions that can show improvement in the patient's ability to manage their disease. I am impressed with how I have grown over the course of this program and have been able to apply nursing concepts in theory into practice. Overall, I have learned a lot about being a leader in the field of nursing. I have also learned that there are many areas in nursing that need fresh eyes to push advancement in nursing practice in this field. I plan on being one of those influencers and hope to add more value to this profession. Thank you and have a wonderful day.